Hello all. In today's video, we are going to discuss about the best diet for irritable bowel syndrome. Irritable bowel syndrome is a functional bowel disorder. IBS is thought to affect between 3.8 and 9.2% of the population worldwide. It is more common in women than men and most often diagnosed before the age of 50 years. Now, the definition of irritable bowel syndrome is irritable bowel syndrome is a group of symptoms that occur together, including repeated pain in your abdomen and changes in your bowel movement, which may be diarrhea, constipation, or both. Cause of irritable bowel syndrome. The causes of irritable bowel syndrome is unknown, but like to be multifactorial. Factors proposed to cause IBS include altered gastrointestinal motility. Altered gastrointestinal motility means the gastrointestinal motility, it occurs when the muscles and nerves in the digestive tract, when they don't work properly. This can cause abnormal contractions or increased sensitivity, leading to abdominal pain or swelling, difficulty swallowing, regurgitation, burping, nausea, vomiting, constipation, diarrhea, or excessive gas. So all these symptoms, they occur due to altered gastrointestinal motility. Next is visceral hypersensitivity. Visceral hypersensitivity is a condition that causes increased pain or discomfort in the internal organ such as stomach, intestine, and pancreas. It can occur due to a number of possible reasons, including stress, illness, or injury. Next factor is impaired perception and processing of information by the brain. Hormone serotonin is secreted in the intestine, and due to altered gastrointestinal motility and visceral hypersensitivity, this hormone serotonin that is essential for the brain functioning. That is, it is a friendly hormone and it is not secreted in the uh, intestine, thereby leads to the stress in the brain. Then low grade inflammation, immune system activation, intestinal permeability. Intestinal permeability is the ease with which molecules we can pass through the intestinal lining. When the permeability increases due to hypersensitivity or mobility of the gut, more molecules can pass through the lining, including potentially harmful molecules. This results in severe pain and indigestion problems and alterations in the gut microbiota. That is, the friendly microorganisms, they will be killed or their growth will be retarded, and the harmful microorganisms, they take care of the gut. IBS is a functional gastrointestinal disorder. Functional gastrointestinal disorders, which is called as disorders of gut-brain interactions and related to problem with how brain and gut work together. These problems can cause the gut to be more sensitive and change how the muscles in bowel contract. If your gut is more sensitive, you may feel more abdominal pain and bloating. Changes in how the muscles in your bowel contract lead to diarrhea, constipation, or both. Major IBS symptoms include lower abdominal pain, altered bowel habit, bloating, excessive passage of wind, that is gas, distension, that is the feeling that there is an inflated balloon in the abdomen. These symptoms, they often wax and wane, and symptom severity varies within and between individuals, and also these symptoms, they may disappear and appear during the like a particular food intake. Diet therapy. A low FODMAP diet improves IBS symptoms. Research says that 76% of IBS patients following the diet reported improvement with their symptoms. FODMAP is an acronym which stands for fermentable oligomonosaccharides and polyols. FODMAP is an acronym which stands for fermentable oligomonosaccharides and polyols. FODMAPs are found in a wide range of foods, including fruits, vegetables, bread, cereals, grains, nuts, seeds, dairy products, processed foods, and beverages. A low FODMAP is effective and recommended as first-line therapy alongside medical treatment in patients with medically diagnosed IBS and alarm symptoms excluded. Researchers discovered that the small intestine does not absorb food maps very well. They increase the amount of the fluid in the bowel. They also create more gas. Food in the colon are easily fermented by colonic bacteria. The increased fluid and gas in the bowel led to bloating and changes in the speed with which food is digested. This results in gas, pain, and diarrhea. Eating less of these types of carbohydrate should decrease these symptoms. It is important to discuss with a registered dietitian to make sure that FODMAP eating plan is safe and healthy for them. So a dietitian will ask you to eliminate food maps from your diet for a particular period of time. Then the carbohydrates can be added back gradually in one at a time and monitor symptoms. A food diary and symptom chart may be a helpful tool to control IBS symptoms. Examples of food that contain food maps include wheat and dry products, chickpeas, lentil, kidney beans, and soy products, dairy products such as milk, milk products, soft cheeses, yogurt, custard, and ice cream, vegetables such as broccoli, beetroot, beans, cabbage, cauliflower, garlic, peas, mushrooms, onions, and sugar snap or snow peas, fruits such as apples, apricots, blackberries, cherries, mango, nectarines, pears, plums, and watermelon, a juice containing any of these fruits. So canned fruits in natural fruit juice or large amount of fruit juice or dried fruit, nuts like cashew and pistachios, honey and fruits with high fructose corn syrup, products including candy and gum with sweeteners ending in all, that is, such as sorbitol, mannitol, xylitol, and maltitol. Your dietitian will suggest you to take more foods of these kind like dairy, lactose-free milk, rice milk, almond milk, coconut milk, lactose-free yogurt, hard cheeses such as feta and brie, fruits including banana, blueberries, cantaloupes, grapefruit, honeydew, kiwi, lemon, lime, oranges, and strawberries. Vegetables include bamboo shoots, bean sprouts, bok choy, carrots, kales, cucumbers, eggplant, ginger, lettuce, olives, parsnips, potatoes, spring onions, and turnips. Protein, beef, pork, chicken, fish, eggs, and tofu. Nuts, limit to 10 to 15 each. Almonds, macadamia peanuts, pine nuts, and walnuts. Grain, oat, sago, rice, corn, quinoa, white rice, corn flour. The idea behind the low FODMAP diet is to only limit the problematic foods in a category, not all of them. After all, they do have health benefits, and you may tolerate some foods better than others. Three phases of FODMAP diet. A FODMAP diet is a three-phase diet, the major goal of which is to find a balance between good symptom control and expansion of the diet. So the main goal is to reduce the symptoms, that is suffering, and expansion of the diet to FODMAP diet. Highlighting these three phases at the outset, establish the expectation that low FODMAP diet followed in phase 1 is not the diet followed for long term. Many people, they have a misconception that low FODMAP diet should be carried out for or should be consumed for a long term. but it is not such. Let us see the three phases. So first one, so here you can see the symptoms are very severe, and while we are taking usual diet, that is a person with IBS and consuming usual diet, the symptom is very high. And coming to the phase one, that is one, he or he consults a doctor and a dietitian. They introduce the FODMAP, low FODMAP diet, in which the phase one is FODMAP restriction. So here, all the foods that contain FODMAP are restricted, and here, what happens? The symptoms reduces. So, like once the symptom disappears or it is reduced, we go to the phase two, that is FODMAP reintroduction, in which the FODMAP foods are introduced one by one, and we check whether the food is accepted by the gut. And the phase three, it is personalization according to the patient's weight, height, body mass index, his lifestyle, the pattern of food consumption, whether he may be a vegetarian or not non-vegetarian, his likes and dislikes, the diet may be personalized. So in phase one, that is 2 to 6 weeks, low FODMAP diet, phase one is for about 2 to 6 weeks, aims to identify FODMAP sensitive individuals and induce symptom relief. High and moderate FODMAP foods are spared for low FODMAP alternatives. Patients eat mostly low FODMAP food in this step. So in phase one, they mostly eat low FODMAP foods. In phase two, FODMAP reintroduction. That is, this phase is for 6 to 8 weeks. This phase aims to identify sensitivities to individual FODMAP subgroups: excess fructose, lactose, galactose, fructose, mannitol, or sorbitol. Patient only progress to phase two if they experience an adequate improvement in symptoms in phase one. Background diet remains low in FODMAPs. Then coming to phase three, this is a long-term diet. So the third phase is a long-term diet, FODMAP personalization. This phase three stages food challenges, like which FODMAPs are tolerated and which are not. Diary function of Monash FODMAP app used to identify challenge foods and record symptoms to each challenge. Aim is to liberalize restrictions, expand the diet, and establish a personalized FODMAP diet for the long term. Patients should now understand which FODMAPs they tolerate and which trigger symptoms they get, sensitivities. Patient includes well-tolerated foods and FODMAPs in their diet and only restricts poorly tolerated FODMAPs to a level that provides adequate symptom control. Healthy eating modifications, that is exclusion diet. So these foods should be excluded during the phase one, that is reduction in caffeine intake, reduction in fat intake, reduction in alcohol intake, avoidance of spicy foods, increase in fluid intake, low lactose diet, restriction of fermentable carbohydrates, restriction of natural and added food chemicals, restriction of gluten. Then the meal pattern and portion size should also be modified. That is, like the patient should eat frequently in small portions. Lifestyle changes include exercising regularly for 30 minutes, then yoga and meditation as the patient's preference. Then supplements include probiotics to increase the good microbial content in the gut. Nice guidelines on dietary management of IBS. Have regular meals and take time to eat. Avoid missing meals or leaving long gaps between eating. Drink at least 8 cups of fluid per day, especially water or other non-caffeinated drinks. Restrict tea and coffee to 2 cups per day. reduce intake of alcohol and fizzy drinks, consider limiting intake of high fiber food, reduce intake of resistant starch, often found in processed or recooked foods. Limit fresh fruits to 3 portions per day. The low FODMAP diet has shown potential in helping people with IBS. Some health professionals believe it's too restrictive. Proponents of the diet report that people stick with it because of how it improves their quality of life. The low FODMAP diet is intended to be a short-term diet that helps patients identify the time and amounts of food maps they can tolerate. Long-term, a personalized diet with minimal food map restriction should be followed to ensure nutritional adequacy. So, to ensure nutritional adequacy, a personalized diet with minimal food map restriction should be followed. Evidence suggests that long term, many patients can achieve adequate symptom control by restricting only a small number of foods. Thank you.